Welcome back. It's good to be with you. Aren't you proud of your success? I'm pleased that you're still involved with us. Sticking to your plan is an excellent relapse prevention strategy. Now we want to review a concept that will help you going forward. After having listened to the patient describe a problem, an inexperienced physician or dentist is at risk to fall into a trap. It is called post hoc ergo propter hoc. All of you Latin students know this means after this, therefore, because of this. We risk falling into this trap as we attempt to change a major behavior. Because one event follows another, we have a tendency to assume that there's some causal relationship between the two.
Don't think that everything that has happened to you since you became a non-smoker is related to your stopping smoking. You are understandably concentrating on this one part of your life so intensely, it can seem like everything else you do is directly connected in some way to your giving up cigarettes.
Let's talk first about some of the positive things that are directly related to you becoming a non-smoker. Number one, you can breathe better. You have greater ability to absorb oxygen from the air you breathe in. The cheetah can run 70 miles an hour, but for only short distances. The pronghorn antelope can run 60 miles per hour for almost an hour. The difference is not due to the antelope having more muscle mass or longer bones. It's due to an increased capacity to absorb oxygen.
Now that you're a non-smoker, you can absorb oxygen more efficiently. If someone tells a good story, you can laugh, draw air deep into your lungs, and not worry that you will start coughing when you laugh. You also look better. You'll find that many of the premature aging lines in the face tend to soften as you reduce the amount of nicotine you take into your body each day. Remember, nicotine is a vasoconstrictor.
You smell better. Most smokers don't like to think that they smell bad, but they really do. You're far enough now from cigarettes that when you have a conversation with a smoker, you think, my goodness, did I smell that bad?
You probably will find that you have greater endurance. You can now breathe in deeply and provide oxygen to the muscles as you walk, as you mow the lawn, or go through other physical activities. You can probably exercise now and not get as out of breath as you did when you were a smoker.
I predict that you're also more relaxed. Nicotine is an effective stimulant. As you pull cigarette smoke into your lungs and absorb the nicotine, it stimulates the body. While you may believe that smoking may you feel calmer, smoking actually increases the level of stress or allostatic load in your body. Smoking causes an increase in blood pressure, an increased heart rate, tensed muscles, constricted blood vessels, and a decrease in the amount of oxygen available to the brain and the body. Nicotine is a stimulant drug. You might relax a bit because you're taking a break to smoke a cigarette, but the nicotine did not have anything to do with your relaxing. This is a good example of after this, therefore, because of this.
You can enjoy pleasant aromas. You probably find that you require less salt and other seasoning on your food because your sense of smell is better.
Many of you who suffer from sinusitis, as I did, have probably found out that your sinus problems have diminished and have perhaps totally gone away. There are also some negative things that you have probably experienced. You probably think about cigarettes, don't you? You may continue to think about cigarettes for up to a year, but you will find that the thoughts occur less frequently and for shorter and shorter periods of time. Also, you need to know another possible negative consequence of stopping smoking. In the non-smoking population, 20%, 1 in 5 adults occasionally have aphthous ulcers, mouth sores. Almost 0% of smokers have aphthous ulcers. However, after stopping smoking, up to 20% of ex-smokers may have aphthous ulcers. Ask your dentist to help if this occurs. There are products that make you more comfortable.
You may also find that you have slight weight gain. 3 to 5 pounds is not unusual. Don't be concerned at this stage about that small amount of weight gain. Many smokers are slightly below what would be their normal weight. When they become non-smokers, they return to what would have been their normal weight. For example, Tom is only 8 pounds over his weight compared to when he was a smoker in 1984.
We talked in week 2 about a reduction in liver hepatic enzymes when you switch from the cigarette as your source of nicotine to the nicotine patch gum or lozenge. As you continue to reduce the amount of nicotine from the alternate products, you'll experience a further reduction in liver enzymes. Therefore, some of the medications you may be using may need to be adjusted. Some medications, such as insulin-containing products, may need to be reduced. This is especially relevant because smokers are 30 to 40% more likely to develop type 2 diabetes than non-smokers. Some other medications may need to be increased. Very important that you talk with the health professional who is prescribing medications for you. Tell him or her that you're reducing your intake of nicotine from the patch gum or lozenge and will be nicotine-free in 3 more weeks. Ask them to determine whether there's a need to change the dosage of the medications because you are now a non-smoker.
You will probably find that you cannot use as much alcohol as you did when you were a smoker. When patients first started reporting this to us, we were surprised. Someone would come in and say, you know, I used to have 3 beers in the evening. Now I find I get a little tipsy with 3 beers. In fact, alcohol is metabolized more slowly in the non-smoker than in the smoker. In other words, whatever amount of alcohol you now consume as a non-smoker stays there longer. This is also true for caffeine. Caffeine is processed 2.5 times faster in a smoker than a non-smoker. If you were drinking 6 cups of coffee a day as a smoker, you may be getting buzzed with that amount as a non-smoker.
You need to continue to take better control of your food intake. We talked about that previously. Try trading some fresh food for some of those high-calorie foods you may have been eating.
We hope that you've started a regular program of exercise. If you have difficulty walking, find an exercise physiologist. Ask them what you can substitute for walking. Perhaps they will advise you to take water fitness classes or start a cycling program. We encourage you to find some exercise that helps you burn off calories and also helps increase muscle mass while decreasing the fat content of the body.
You have just completed 9 weeks in the Clayton program. For most of you, that is 9 weeks off cigarettes. Don't risk your gain by not continuing to view the video. Don't get overconfident. You're still at high risk because you're still too close to cigarette smoking. Don't risk that gain by thinking you can now have 1 puff or 1 cigarette. You have distanced yourself far enough from cigarettes that you risk becoming a little bit cocky. Don't let that happen to you. A number of the smokers we have worked with have gotten in trouble because they thought they could have just 1 cigarette. Your mind plays funny tricks on you when you're dealing with mood-altering drugs like nicotine.
Those of you using the Nicoderm CQ patch who smoked more than 10 cigarettes per day, continue the 7 milligram patch next week. Making the transition from smoker to non-smoker, trading an unhealthy behavior for a healthy behavior, takes time and discipline. Going through this 12-week-long program is very little time when compared to the years that you spent with an unhealthy behavior, smoking. Continue viewing the video as you learn a healthy behavior, non-smoking. Buy yourself some protection. Protect your game.